Hi everyone, this is Caroline,
And Mollie.
and our topic today is on autism spectrum disorder. Welcome. Um, Autism spectrum disorder causes delays or problems in many skills from infancy to adulthood. And so, autism is a developmental disability that begins at birth or within the first 3 years of life. It results from neurological disorders that changes the way the brain functions.
Asperger syndrome is the highest functioning version of autism. They are intelligent in specific areas and can go on to have a career and a family, but they do have social interaction problems that can be treated with therapy. They can also be treated with a special education teacher who will teach them social skills, developmental skills, and emotional control, an occupational therapist who can teach motor skills and hand coordination, a speech language pathologist who will teach them speech, and a developmental psychologist who will do cognitive assessments. The main deficits that they have include poor social interaction, communication problems, behavior problems, sensory problems, tactile issues, and hypersensitivity.
So, in our first article, this is a physical activity program that was started in a school with autistic kids, and they they put kids in 12 groups per each class, and these children had not worked in a large group like that before, and so the program took like 45 minutes every day. And so while they were doing that, they had to incorporate physical education teachers, the subordinate staff, and they also incorporated the parents of these children so that when the children got off school, they still could continue working on the physical activities that they learned in school at home. And so by the end of that semester, the findings were very encouraging because most of the kids that participated had improved on behaviors. They had improved on their behaviors, and also their body image, their posture, their coordination, their muscle tone, and cardiovascular fitness had really improved. So physical activity is very important to children with autism, and the earlier they start it, the better for them.
So, for the autism research study, researchers wanted to know if karate techniques would help children with autism. For the study, they had 30 participants ranging from ages 5 to 16 years of age from one of 3 specialized institutions for youth with autism spectrum disorder were randomly selected to participate in the study. They had a control group which included 15, and they had the group that received the treatment, which was 15 of them. None of the participants dropped out of the study, and all of them completed training sessions in fall. Prior to starting the experiment, parents, caregivers, and teachers were asked to make precise observations of the participants at home and in school environments for 7 days, and they scored them. They had 20 qualified trainers to teach the children karate. And the results of that were that instructing the children in karate improved their communication deficits, even 30 days after their research concluded. They also concluded that their mental status improved across the ages. So basically, the children who received the karate training improved their communication deficits compared to those who did not receive the karate training,
And so the autism, you see, like when autistic kids are put into physical activity, and if they have like motor skills problems, as they continue working in the physical activity, they kind of like improve in their motor skills. And at some point, they'll even be able to work on their fine motor skills. So that is very important. And bearing in mind that autism is a spectrum, so you'll see so many kids with different deficits, as Molly had talked earlier on.
All right. So then we have our works cited here, which includes the autism article and the research study. All right.
Thank you, guys.